as many have known, we are going through some even more difficult times. We have a fire right out of Peru with over 3,000 acres going, the Holster fire with 20% containment. And I would like to say thank you to our fire department, CAL FIRE, USFD's fire for all coming together really to make sure that our community is safe. More information on this fire is at www.vcemergency.com. Also has update information on the evacuations and also the staging areas. The governor has also put a state of emergency on our fires, our power shutoffs, along with the COVID-19. And as I was driving home last night, I just thought of how resilient our community is. Since the Thomas Fire, we have year after year been dealing with many different disasters. And I want to say thank you because you are all so resilient to be going through this. I was on a state call yesterday talking about the needs of our community and some of the other state counties having gone through this. And we have really learned a lot from the years. And so I want to say thank you to our staff, our community, for really stepping up, doing the lessons learned, and so that each disaster that we've been going through, each fire, has been easier on our community because we know what to do. We know what to expect, and we can move and conquer this. So today we're going to be talking in regards to COVID updates. Our public health director will be giving an update on our order. We will be getting updated on testing, on our health and safety for our cooling centers, and also being energy, monitoring our energy use with our flex power shutoffs. The governor is asking us to really monitor our usage can utilize it. I personally have been on many emergency calls just this last week talking about opening up businesses, what the state's plans are, pushing for our small businesses to get open in a safe manner. We're talking about the monitoring of our power, how it becomes. We're talking about schools and how Ventura County can get off the monitoring list. But along with the monitoring list for us getting off, which is having a healthy community, we also have to have the state orders lesson as well. So we are urging our state officials, our California Public Health, to work with our community, our county of Ventura, our public health director to make sure that we can do the best we can for our community. So with that, today we will have Dr. Levin, our healthcare officer, for public health speak. Following that will be Barry Zimmerman, our deputy director for our healthcare agency. Chris Rosa, deputy administrator for our emergency medical services. Alejandra Tellez, our sustainability officer. And following to close, Mike Powers, our CEO. So just again, please be safe out there, stay cool, and we will talk soon. Dr. Levin, thank you. Let me wipe this off. Thank you.
Thank you, Supervisor. We've got a heat wave going on. We have fires. We have lightning strikes throughout the state. It's overwhelming. I'm going to focus my comments on the COVID and the issues related to it. There have been 626 people tested now for COVID, 54 more cases identified, and one additional death in a 65-year-old who had comorbidities. That brings our total number of deaths to 98. This is twice the number of deaths that we have seen with the worst flu season that we've had in the last quarter century. Today we have, throughout our county, 74 hospitalized COVID-positive cases with 30 patients in our ICUs. The daily case rate now is 113, and this is down significantly from 1 month ago when it was at 186. Our numbers have stopped going up on a steep incline. They've leveled out at a new plateau. It's too soon to say how far down we're headed. I'm hopeful that we're headed down to where we were on June 1st, when we had only 18 cases of COVID patients hospitalized throughout our county. Now we're hovering at 75. We were as high as 100, so we've made good strides. Gatherings, and more gatherings were the source of the most recent surge that took us to that height. Holiday weekends were the big drivers. Rallies were potential contributors. Activities that bring people from different homes together is another, under a different roof, is another likely contributor. But one of the real drivers were and are the small get-togethers. When you think about it, those big holiday weekends are nothing more than events that sanction small get-togethers, like family gatherings, parties, barbecues. They're an excuse for multiple small gatherings. So if we want to avoid another surge, all of us must show a bit more resolve. No parties or gatherings, or dinners or celebrations, whether under the umbrella of a holiday or on our own. And we've got some holidays coming up. So what we as individuals and as a society need to do is to plan, not to plan. We can do this hanging in here like we have been a little bit longer. We're hopefully getting to the point in this pandemic where we may have more of this behind us than we do ahead of us. So Labor Day is on Monday, September 7th. That's 2.5 weeks away. Don't make plans, please. If you've made plans, cancel them. You're canceling them because you love the people you've made plans with and because you love your county. Plan not to plan. Looking back at the July 4th weekend, let's not do that. Let's be the county that doesn't surge. Let's be the county that reopens our businesses and keeps them open. Closed businesses hurt all of us. Finally, we've come to an important decision in public health. While we're on the governor's watch list, because of your hard work, and there's no other way to say it, your self-denial, I'm hopeful that we're heading off that list. 2 weeks after we come off that list, all of the schools, kindergarten through the 12th grade in our county, will be able to open up. But the governor has established an early exception opportunity for counties that have achieved a certain degree of improvement in their COVID numbers. This is referred to as a waiver application program for an early opening of schools for children kindergarten through 6th grade. Our county has been eligible for launching such a program, a waiver program, for weeks now, but we have not. We wanted to see our COVID numbers further improve. A concern on the minds of many with school-age children in our county is whether or not it's safe to return to in-person education. And this is what this program will allow. While I recognize that there are good reasons not to open up our health department to request for waivers for person-to-person education of children, little children, I now feel that the benefits outweigh the risks. Research shows that our youngest children derive significant benefits from in-person interaction with their teachers and with one another in the school setting. As a public health officer, my first instinct is to take whatever steps are necessary to keep people from interacting with one another, to quarantine ourselves until we have an available vaccine for COVID-19 virus. But this is, of course, too simplistic an approach. It's unrealistic. I think that children K through 6, can receive education in a manner that is both rewarding and safe. I recognize that this will be challenging, but if social distancing protocols are rigidly adhered to, disease spread can be limited or prevented altogether. And if we start to see significant disease spread in our county related to openings of some of our schools, we will act quickly to limit this trend. Also know that it will be a challenge for schools to get waiver approval. It will not be a done deal. Applying schools will have to meet rigorous standards of safety and responsibility. For these standards, all grammar schools applying for waivers, public or private, are directed to shape their applications to the document Framework for Reopening Ventura County Schools at the site, the Ventura County Office of Education, or vcoe.org/coronavirus. One of the most challenging aspects of the waiver application will be a school's plan for regular COVID testing of its staff and of its students if they should show symptoms of an illness. The waiver application itself should be sent to covidschools@ventura.org. The American Academy of Pediatrics, as well as Harvard's Global Health Institute, the Chan School of Public Health, and the Edmund J. Safra Center for Ethics all advocate for and have developed criteria for the youngest students to be physically present in school this fall. The importance of in-person learning is well documented, and there is already evidence of the negative impacts of closing schools down early in 2020. Young children need to be in school not only for education purposes, but for invaluable socialization experiences. They benefit from the supportive services, the absence of which makes it difficult to identify and address important learning deficits, as well as child physical or sexual abuse, substance use, depression, and suicidal tendencies. These are real issues. There is also substantial impact on hunger and physical inactivity. COVID-19 virus appears to behave differently in children and adolescents than other common respiratory viruses such as flu. Although children play a major role in spreading the flu, to date, this does not appear to be the case with the COVID-19 virus. Although many questions remain, the preponderance of evidence indicates that children are less likely to be symptomatic and less likely to have severe disease resulting from COVID-19 infections, and, in addition, children may be less likely to become infected and to spread the disease to others. COVID-19 policies are intended to decrease, not eliminate, risk. No single action or set of actions will completely eliminate the risk of COVID-19 transmission, but several coordinated interventions can greatly reduce that risk. For example, in schools, regular COVID testing in those schools, physical distancing by reducing classroom size, small, stable groups of students, health screenings each day, and students, at least those over 2 years of age, and staff wearing masks all maximize safety. So those are my comments for today. Next, I would like to introduce Barry Zimmerman. Barry Zimmerman is the Chief Deputy Director of the Ventura County Healthcare Agency. Thank you very much.
Thank you, Dr. Levin. Today I'll cover some areas of testing. There are 4 areas I'd like to discuss today. 1 on testing locations and some changes we've had there. 2, we'll talk about the activity and volume of testing that is occurring. 3, we'll talk about the priority of who should be tested and where you can get testing. And 4, I'll go over some details on the types of tests that are offered into the community and hopefully clarify the importance of the different types of testing. First of all, the locations and some changes that we've had. As you know, we have sites throughout the county, and some are county-run as well as state-run sites in every community. We have moved the site from Ventura College to the fairgrounds. And so now at the fairgrounds in the San Miguel building is our testing site for the community. That site is a walk-in site, a little bit different than a drive-through, but still it is at no cost and no appointment necessary to access the testing at the fairgrounds. The college site will have signs up directing individuals to go to the fairgrounds for that free testing location. In addition, we had 2 sponsored sites from the state of California, one at the Oxnard Performing Arts Center and one at Newberry Park Library. I am regrettably to inform you that the state has chosen to shut down the Oxnard location at the Performing Arts Center, and so that will be shutting down and will not be a future option at this time. However, just a little distance away at Oxnard College, our drive-through site has expanded its capacity from 2 lanes to a maximum of over 6 lanes that can address any increase in volume needed for that testing. So no appointments necessary at the Oxnard College location, and it's free for anyone who decides to have their test performed there. Right now, all sites are expanded and have plenty of capacity for individuals who desire to be tested. Currently, our volume of testing has declined a little bit in there. We average about 2,000 tests a day, and that's over a 14-day period. That is well above the state's goal and requirement of our testing capacity, which is around 1,200 tests per day. So we're about at 160% of goal right now. And with that, we have no wait times occurring at any of our drive-through locations, as well as appointments are scheduled and available at our urgent care clinics. So as a summary, we have plenty of testing capacity, and we have test locations throughout each community. And I'll go over those really quickly. We have our no appointment drive-through locations, one in Santa Paula at the old Ford dealership. That's on Halleck Road and 126. We have Moore Park College, and we have Oxnard College. And for the Ventura region, we are now at the fairgrounds. All those locations, you do not need an appointment, and it's free. We have 7 urgent care centers throughout the county, from East County to West County, that are associated with the Ventura County healthcare system. And you're able to call and make an appointment to access those testing locations as well. And finally, we have the Newberry Park Library location. That is a state-sponsored location. Working with us is also available. Now, I did mention that our testing volume has declined over the last number of weeks, and we also want to express the importance that testing is still needed, that we still need to identify those that may be infected, whether they have symptoms or whether they're asymptomatic. We need to know in order to put in the best precautions to prevent the spread. I will remind you, we encourage anyone who has symptoms of COVID, which are most prominently an upper respiratory cough, as well as fever, or any flu-like symptoms, you may be have COVID, and we would encourage you to seek testing right away. In addition, those individuals who have been exposed to someone that is known to be COVID positive to seek testing as well as those individuals who work in occupations that don't allow social distancing but interacts with many different people, such as in a manufacturing environment that you're working in close quarters and coming in contact with multiple people, or that you might be in a service industry, vital service industry job, let's say grocery or retail that's open at this time that interacts with the public. You may be exposed to more individuals, and we'd encourage you to be tested as well. Finally, I'd like to just go over the different types of tests that are available in the community. There's been a lot of information and advertisements out for what are known as rapid tests, and those tests are in the community. The majority of them, as a matter of fact, all of them that I know of, do charge for that test to occur. They advertise that they can be done in 20 minutes, less than an hour, and they do charge for those. Some charges are extremely high, and we caution you in taking access of those tests. The majority of the rapid tests are a different type of test that is also being administered than what is being administered at our testing locations. And I'd just like to go over the distinction between those two a little bit. Both of them tests do look for the virus to see if you're actively infected. One is known as an antigen test, and the other one is what we commonly refer to as a PCR or a viral test. The PCR viral test is the test that we use at all our location and is the most prominent and authorized test for accuracy to determine if you have the infection or not. It is supported and has been certified by the FDA, as well as is endorsed by the CDC on detecting the virus. The rapid tests most commonly used is an antigen test, which is good for an individual who has symptoms and is positive, but cannot be used reliably for an individual who is a negative test, meaning that if you go to one of these rapid sites and get a negative test, the FDA and other medical community cannot use that as a rule out that you do not have COVID. And the advice under the authorization for that test is to refer you to get a PCR test. So I know speed may be your goal in order to receive a test. However, the reliability to assure you whether or not you have the virus or not is not as accurate with those rapid tests. So at our testing sites, which use the PCR test and is the most reliable, we do have electronic notification on the testing up and running at this time. We do tell you it takes about 3 to 5 days to receive your notification back. On average, we have been actually experiencing about a 2 to 4 day turnaround on those tests. So at this time, I would just remind you that you can go to vcemergency.com, and on there's a flyer that gives you the detailed information of the testing times and locations that are available for you to receive a PCR viral test. And there is, at our drive-through sites and walk-up site at the fairground, no appointment is necessary, and all the county-sponsored site, there is no cost to the recipient who wants to receive that test. So I encourage you, if you fall in one of those priority categories to be tested, to continue seek testing so we can understand and best control the virus. Now I'll turn the time over to Chris Rosa, Deputy Director of our Office of Emergency Medical Services.
Thank you, Barry. Good afternoon. Ventura County has been in the midst of an extended duration heat wave for the past several days, and we want to take the opportunity to remind you of some key points that will help minimize the impacts of excessive heat now and during future events. High temperatures may create a dangerous situation in which heat-related illnesses are possible. Drink plenty of fluids, stay in air-conditioned rooms, stay out of the sun as much as possible, and check on relatives and neighbors. Take extra precautions if you work or spend time outside. When possible, reschedule strenuous activities to the early morning hours or the evening time. Know the signs and symptoms of heat exhaustion and heat stroke, and wear lightweight, loose clothing when possible. Children, the elderly, and those with significant underlying medical conditions are most susceptible to the effects of heat. No person or pet should be left in an enclosed vehicle for any period of time or in direct sunlight for an extended portion of time. Temperatures quickly rise to life-threatening levels in vehicles, even if the windows are partially down. Here are some reminders that may help during periods of excessive heat. Check on the people you know who may need assistance related to the heat. This could include family, friends, and your neighbors. Use air conditioners or spend time in air-conditioned rooms, such as designated cooling centers. Currently, the cities of Fillmore and Santa Paula have cooling centers open. Check your city's website for more information on cooling centers and locations or hours of operation. Minimize your direct exposure to the sun. Stay hydrated. Drink water or other non-alcoholic fluids. Wear loose-fitting, light-colored clothes. Avoid wearing heavy, dark clothing. Never leave children and pets alone in cars for any amount of time. Avoid drinking alcohol as a way to stay hydrated. For more information on heat emergencies, please visit www.readyventuracounty.org. Next, I'd like to introduce Alejandra Tellez, Sustainability Officer for the County of Ventura.
Thank you. I wanted to share with you a couple of the programs that the county is currently offering to make our homes safe and resilient. And safe and resilient during this heat wave, we need to make our homes comfortable. Some of those programs are run through 3CRN, which is a regional program with the County of Ventura, County of Santa Barbara, and County of San Luis Obispo. And what that means is that we need to retrofit our homes in more than just switching the lights to make it more efficient. We're talking about double pane windows, insulation, using weather stripping, and what that means is going to keep your home cool. Like said previously, we need to stay safe and comfortable, and this is one way that we can do that. And what the county is doing is offering a program where you can call and you can get an energy efficiency audit for your house. Currently, we are doing that virtually. You call, and somebody will kind of walk you through and have you inspect different areas of your house and recommend several retrofits that you can do to make your home more comfortable. What we're also doing is helping businesses be more safe and efficient. And what we have is we have a green business certification program. And what that means is currently we have somebody also kind of come in. If it's safe, we can come in and do it in person, keeping our safe distance, or we can also do it virtually. And that's also the same thing, kind of running through your business, figuring out what it is that we can have them fix. You know, it can be anything from switching the lights. It can be more water efficient. It can be anything from kind of switching something that's going to make your employees a little bit more safer. And what we're also thinking is it's something that we can currently we're in the middle of a heat wave, right? And we're currently in the middle of staying home. But it's something that they can start thinking about making your home more efficient. Something when maybe in a couple of months that you're thinking, hey, I should maybe think about switching my windows. So you can call the programs that the county is offering so we can make sure that we offer that resource to you. One way that you can do this, check our website. We have several websites that you can check, 3crn.org. You can check our regular county website, or you can call 805-541-3806. And now next we have Mike Powers with the County of Ventura.
Good afternoon, Ventura County. Lots going on, to be sure, and really appreciate hearing from the county's sustainability officer, Alejandra Tellez, and all the wonderful energy savings programs that that department is leading. It's a real priority for our Board of Supervisors, and we know for our community, and this really helps with our homeowners and local businesses. And what a great time to be saving energy, of course, right? And I really want to thank you, the community, for reducing your energy usage, because it's preventing the rolling blackouts that we would otherwise be having, and the prospective power shutoffs that could affect our community so negatively in so many ways. So thank you for what you're doing, especially during this incredibly stressful time. So I want to just turn to the numbers. We heard Dr. Levin talk about our public health numbers, and I want to show that to you just for a moment. And as you can see, there's 6 measures that are really important. Green is good. So as you can see, because of the work that you're doing, the county, we're green on 5 of the measures. You see our positivity rate at 7%. Under 8% is good, and that's actually going down a bit. The case rate of 113, we want that to be under 100, but it's heading in a good direction. It's been up as high as 187, so that's very positive. Also to the far right, the average daily tests per day. The state wants us to be at 150 per 100,000. We're at over 234 in terms of our testing capacity. And that is so important, I think, because it makes all of these other numbers more real, more realistic. It gives us a truer sense of the community spread of the virus and where we can identify it, stop it, and trace it and track it. And so, as you can see, good progress. Again, that's the work that you're doing, and continuing to wear masks and physically distance. This is the result, and this also helps with our businesses and schools. And as we heard Dr. Levin talk about today, a major milestone, he's going to start accepting waiver applications from schools in our community, and that's because of those good numbers. So thank you. A real priority for us, of course, as well, is supporting our vulnerable populations. It has been in general before the pandemic, and especially so now. And just, we present a lot of numbers to you, but we also want to tell you a story and that you might not be aware of sometimes. And so we had a farm worker, been out there working hard through all of this, but he tested positive for the virus and was going to go back home, but his landlord told him he wasn't allowed to go back home. And so he was stuck and could have been homeless, and he was actually going to end up maybe sleeping on his lawn of all things. But because he knew about the county's farm worker resource program, he contacted them. They contacted Public Health, Human Services, and they were able to get him into a hotel and also transport him there. And so now he's safe and well and recovering. So just to give you a little sense of the kind of work that's going on around the clock here. The board also supported, and the Human Services Department sent out those rental assistance checks to 1,690 families, and that's $11.4 million, 3 months' rent, and so we know that's helping. And the board is also partnering with the ag community to develop further housing support for our farm workers, and that will be coming back to the board in September, and doing a matching donation contribution program with our generous ag community. We also wanted you to know that in terms of the homeless assistance, that continues to happen. We have 105 seniors or medically fragile homeless who are housed now in our Project Room Key voucher program, and we continue to wrap around health and social services to those folks. Also, in Oxnard, we're pleased that the Homeless One Stop has restarted at Community Action, so showers and laundry services are available. That's every Monday. And then the county continues to have its homeless one-stop programs that also has the healthcare agency's backpack medicine program combined with it at 7 different locations throughout the county. And the best way to find that is at VenturaCountyRecovers.org. Our veterans, right? We need to do everything we can to help our veterans. And so also want you to know that United Way is doing an amazing job. They have provided support for 44 veteran households in local motels, and 6 of those folks have actually received permanent housing. So in the midst of all of this, folks are looking out for our veterans, as we should. Our business community, we know, has been tremendously impacted, but a lot of progress in those areas. Businesses continue to sign up at VC Reopens, and we need you to. We're at over 13,250 businesses have now registered. We need all businesses in the county to register. That will help also in terms of compliance and the business ambassador and not an enforcement program, just a consultative program to help you comply. And we're seeing the results because when the state comes down to inspect, they've inspected over 2,600 businesses. They've only issued 3 citations. So just a spectacular compliance record, a tribute to our businesses. We also know we need to support them, and the board knows that, and they've supported the Business Assistance Program. And we're pleased that with our partnership with the Community Foundation, starting August 12th, checks did start to go out. Over $2 million in checks have already gone out to local businesses, $5,000 grants to each of these local businesses. More to come. The board has approved $15 million of CARES federal funding for this program, and we're going to be bringing a request to add to that on September 1 to the board, because we know it's a top priority for them and for our business community and our chambers. And really want you to know, too, that we need folks who've already applied to make sure you get your documentation in. We want to make sure we can fund all the eligible businesses and who have qualified with all the documentation that's needed. You have till August 26th to do that. We urge you to do that. Get that documentation in because we want you to get one of these checks. And again, just to reiterate, is our goal is to fund every eligible qualified business who has applied. And so, again, those are numbers, but just to give you a sense, just a couple of the businesses who've received them, one of them was a hairstylist business, and they told us that literally the check came just in time. They were going to have to shut their doors. And so we know that it's making a difference there. One of them was a custom gift business who just started in January. They had a warehouse full of gifts. But by getting this grant, it enables them to stay open as they increase their sales efforts. So it is making a difference, and the board wants to make even more of a difference. So continue to get that paperwork in so we can get those grants out to you. Last thing I touch on is just the census, right? So much going on, but this is once every 10 years, and the deadline is September 30. We need everybody in our community to sign up. We're really proud of the work that is happening in our community here. The county, there's 58 counties. We're number 4 in the state in terms of getting folks to sign up. That's great. But it's still not enough. We want to finish really strong. This is so important for our community, as I say, every 10 years, because this is our only shot at it. And it makes a difference in terms of community programs, schools, roads, you name it, the funding that is drawn down, business support services that we can provide here. But also it is actually businesses who use this data the most for marketing and to determine also where to locate businesses and different kind of products and so forth. So it's just good for our community as a whole. So we encourage you to sign up, and it's going to make a big difference for our community. The best way to go there is to our website at my2020census.gov, my2020census.gov. And so with that, last thing I'd say is, there's so much going on. But our first responders are out there every day. Right now, they're out there in the incredible heat. One of our brave sheriff deputies was out patrolling the other night at 2 in the morning and got rammed, just totally unprovoked by a perpetrator. So much twice actually, and his patrol vehicle flipped over. He's okay, thank goodness. But the sheriff was able to, because they do such a great job, they were able to capture the perpetrator. But just right there on the front lines, trying to help us. Our firefighters, just incredible work they're doing in the heat, literally out on the front lines. And if that's not enough of a challenge, I just saw a video of a group of them were fighting the fire on the front lines, and a bull with the horns and everything had to chase them down the road. They had to run away from that bull and then go back up there after the bull left to go continue to fight the fire. And we actually had 2 firefighters who were injured. because they were on the front lines and the wind shifted. And so, but the good news is I understand from our fire chief that they're doing well. But it's just a reminder that these first responders are out there every day for us, helping protect us, and we thank them for their service. So, and again, to the community of Ventura County, you can see the numbers. You're making a difference. You made it the first time. You're making it the second time, and we thank you. And so just stay safe and take care and stay connected. Thank you.